I woke up one day and I couldn't walk. Let's get into it. So it's been a year since I posted a TikTok that went a little bit viral. And I was basically posting from inside the hospital while I was still a patient, and I just had my spine surgery. And a lot happened. I do want to say sorry to everyone, because I did say in my last video about this that I wouldn't be quiet. I did have to take some time to get myself right in terms of mental health and physical fitness. Um, to give complete context, I really mean it when I say I woke up one day and I couldn't walk. I couldn't bend, I couldn't twist, I couldn't sit up, I couldn't, I could barely get to the bathroom. I was sort of crawling to get there and not really making it there when I did. Or when I stood, I would be like sort of the Leaning Tower of Pisa. Um, it was a bad situation. I was sort of laying on my sofa for 3 days, with a snack box and a 5 litre bottle of water, just trying to survive because I just couldn't do anything with my body. I couldn't twist at all. I was in excruciating pain. Even now, sort of thing, I'm still struggling to sort of activate my lower back. I'll get into details later. And I'm obviously on tramadol and opioids every day and all that stuff. And I've got aids in my house, but this isn't this isn't actually a sob story. This is not a boohoo. This is not me feeling sad for myself, because people break every day. People get hurt. This story is really about the treatment I got in that hospital, in two hospitals actually. At best, I can call it neglectful. What I will say is, from my video that I posted, a lot of your comments were saying a lot of the same things, that people have, cousins or aunties or a friend who's going through the same situation, or something similar, where, they've seen a lot of things happen, and they're just not comfortable leaving, their family members or their loved ones alone with the NHS, that they have to be supervision and all this stuff. And I think my issue is that everyone seems to be okay with the status quo. Everyone knows there is an issue, whether it's they're understaffed or, so on and so forth. But if there is an issue, shouldn't it be something we address? Why is everyone okay with the standard of care that we're giving? Was really supposed to be proud, and I want to be proud of the NHS. I have friends and family that work there, and have worked there, and so I do know there's great souls, there's good souls that work there, that actually care for patients, and this just isn't what I saw in this situation. So um, I'm going to cut to the chase. I followed your advice on that TikTok. I listened to your comments. A lot of you guys said complain to PALS. And that's what I did. After I posted that video, I sent an email right to PALS from the hospital bed saying, can you come down and speak to me before I'm discharged? Or, can we set a meeting up to have a conversation? Because I sent you an email with bullet points of this, 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 and this, and this, and this, and this, of everything that's happened. And I can't share, everything in one email. So can we meet to discuss it further? I sent that email, and like I said, I'm just going to start sharing receipts, because you guys are going to have to be detectives for me, and I'm going to try and keep this story short and sweet, but it might have to be a few parts, because Bart's replied to me. They replied to my TikTok. They DM me and they just said, come reply to PALS. I always say did that, and that was on April 5th. I will say I got great behavior from the nurses following that video. I got donuts and extra blankets. So, I know they saw it, bless them. So they knew that, my complaint was coming. Off the back of your comments after sending that PALS complaint in, it took 24 days for them to get back to me. 24 days. And they said that even though you've bullet pointed everything, and you've put it in details, and, things like you're moving the call bell, and, here's this organization power, send it to them and they'll help you write it better, because it's just not enough for us. This is this Michael person. Now, I've obviously replied back straight away and said, hi, I sent you a lot, and I said, can you meet me, or, do something towards that direction? Can we do something towards that? And he completely ignored that email. Fast forward to the start of January. Like I said, I was taking care of myself. I yeah, it's not been fun. It's not. I'm trying to be positive about the situation, but I'm in pain. I can't lie. This is annoying. Sorry, we divulged. Digressed, diverted. One of the words. Something die. Um, so got to January, and I sent another email saying, "Hi, Michael. I haven't heard from you. You know, I'm still waiting for a reply for this email." And then Michael replied back within 4 days, so quite instantly, and said, "Hi, I can confirm you are a patient at this hospital and this hospital." He got back to me and said, "Can you send more details? We'd love to hear more things from you. We take all complaints seriously, whether formal or informal, and we'd love to hear more details. Can you share everything that you have, whether it's video, audio, etc., etc., and we'll look into it." Um, I basically sent him the exact same thing. Like he asked me, I sent the exact same thing to him, and now it's complete complaint that he's taken into process. They get back and say that they're going to get back to me in 40 business days. That was supposed to be March 12th, been and gone. They sent another email saying another 40 business days. That's supposed to be April 22nd. And I just don't think I'm patient enough to wait anymore to deal with the situation. So like I said, I'm sharing receipts. The only thing that was a bit suspicious was that Michael's title has gone up from sort of, what was it? It's gone up from clinician lead to clinician manager or something like that. Complaints and risk lead to clinical governance manager. So he's been promoted in that time, and now he takes all complaints seriously. And now he's actually made a report to PALS on behalf, and he just, he didn't ignore it this time because I'm so sure it's very, very important to them. But let's get into the actual story. So, like I said, for 3 days, I was on the sofa. I couldn't sit up. I couldn't bend. I couldn't twist. I could not, for the life of me, do anything except lay on that sofa and cry and eat snacks because I couldn't reach further than that. And like I said, I was having trouble going toilet. I was having trouble doing on any of it. And after a while, I just kind of gave up and said, I'm taking as much codeine as I can to sort of the maximum dosage that's possible. And I don't want to, there's nothing I can do to help. So ambulance. I called them at sort of 10 o'clock in the morning. They didn't get to me till sort of 2, 3-ish. But the ambulance lady came in and she basically gave me like gas and air and went back down for the wheelchair because she realised I was in excruciating pain. Like I was screaming just to get in that chair. It was, sorry, I'm laughing, but it's terrible. It was very, very, very painful, and I just didn't know what was wrong at the time. Now I finally got to the ambulance bay, and as you can see, I've, just relaxing because there's nothing I can do other than lay here. I literally can't do anything. I've called my mum, I've called my friends, and said, SOS. And they sort of parked me outside the corridor, outside where the doctors and nurses stations are, with their computers and all that stuff, in the middle of A&E, till about 11:30 p.m. when the doctor finally saw me. I think he realised I was in a lot of pain as well, and he sort of suggested that we would get a suppository, so a pain medication that they kind of, but just because it goes directly to the pain site, and it should have affected a bit better, but that didn't even help. And yes, when he's informed me that I'm spending the night, we fast forward to day 2. Actually, I think we should bring in Nurse Rhoda. The 2 nurses that have officially been ignoring me for 2 hours now. I don't know their names. I will find out for you because I'm not even being nice about it anymore. I hope you're proud. Nurse Rhoda was a problem just because she kept, at this point, she's assumed that I've got sciatica, which is the pinched nerve, which is one of my symptoms, but it's not all of my symptoms. And she has been like sitting me up in my bed, forcing me to sit up and eat when I'm telling her I can't sit up and that straight because I'm literally in pain and it hurts so much. But she was telling me that I just have to stretch it out, and I'm young and I'm agile, and the pain's in my head, and I just get up and try and walk. At this point, I'm literally asking for help to someone to help me carry me onto the commode just to go toilet. Like I can't do anything myself. I was definitely bedbound. And she was actually sitting me up as well as pulling my legs to straighten them out because, the straighter the better. I'm so sure that didn't help. but we move because, sorry, she really annoys me. Because she thought she knew better. And whenever I kept telling her I'm in pain, she kept telling me that I'm not trying hard enough. This is also the same nurse that when I told her that I keep puking up the food, because I could tell after the second hospital that the first hospital had been microwaving their food, and I just have quite a sensitive stomach to stuff like that. So I couldn't keep down the meals they were giving me. So sort of by the second, third day, Rhoda had seen me a couple of times by now. And I just couldn't keep the food down, sort of thing. And I obviously I'm taking pain medication, so I need to keep my strength up, all that stuff. It got to a point where I'm asking her for pain medication, and she's telling me I can't have pain medication because I keep being sick. And I keep telling her that I'm not being sick because of pain medication. I'm being sick because the food is inedible, and that I need the pain medication because at this point it's barely working at all, but it's the only thing giving me any sort of relief. I'm still. This is 2-3 days of being in pain there because I was at the first hospital for 4 nights. And then she decided to ignore me for the whole day. So from noon, because she started her shift in the morning, she was a day shift nurse. From noon till 9 p.m. when she changed shift, my mum came at that point to ask her why she was ignoring me. And she turned around and started telling my mum all my medical information, not even knowing who she was at that time. She doesn't know. To my mum, yes, she looks like me, but she wasn't even answering me. And I'm asking her, when can I have my pain medication? When am I due? Are you going to keep ignoring me? But there were nurses like that around the situation who just kept being a bit ableist and saying, the pain's in my head and I should just be able to get up and go, accompanied by the doctors who kept doing it. There was a doctor who also kept making jokes. I would see him for morning rounds and night rounds. And every time I saw him, he would be like, just get up and walk. Are you ready to go home now? One time he even said, oh, I see you're laughing with your friend. That must mean that you're ready to go, because anyone who's this happy must not be in pain. I think obviously by the third day I'd had enough of all the treatment, and obviously no one had actually examined me at this point. No one had physically touched me. They just kept dosing me up with pain meds. And I'm in the A&E bed section, just waiting every day to be able to actually get up and walk. I would love to, but because no one can, they address me. It basically took me crying, and I mean like crying, like I was crying like I had my own movie storyline, and there was slow jams R&B playing in the background or something, because basically all the staff kept walking past and knew that something was wrong because I wasn't quiet about it. I was actually in distress, and my one of my uncles actually ended up being on the staff, and he came and said, what's going on? I've heard that there's a lot of distress going on in this room, and I didn't realize it was you. And I basically just broke down, and I told him, I wish someone had actually examined me. I wish someone had actually looked at me. I can't keep complaining about something as simple as not getting my medication. I'm getting all the medication I'm getting at least 2 hours late. And then when I do get offered it, I say, can you give everyone in the room first? Because I know that you've at least delayed theirs as long as you delay mine. I'm complaining because, this nurse Rhoda, she'd put me on the commode and say, press the bell when I come back and get you. And then I'm left on the commode for another 45 minutes while my legs have gone completely numb, and I'm obviously surrounded by smells and sounds, and I don't feel comfortable. And she keeps leaving the curtain open. I keep asking her to close it, and she keeps coming back and saying, why are you pressing the bell? And leaving the curtain open, knowing that I'm pressing the bell because she told me to press it for assistance. Anyway, losing battle. I spoke to my uncle, and he said that he would speak to a doctor to come and see me that night, because I can't just keep asking for help. Something has to be done. And a woman came to see me that night, and she basically tried to ask me a few questions, but before she could even get into the flow of the questions, I'm obviously sitting on the commode, trying to go, but I'm straining, I'm struggling, I'm sweating, and she's like, there's no way, now no one should have to struggle this much to have to go toilet. So she's going to ask the doctor in the morning rounds to actually see me properly and look at me and actually talk to me. Introducing Dr. Julie, where in the morning she starts asking questions, and she's asking, what are your symptoms? What have you gone through? And I've explained, I can't sit up, I can't bend, I can't twist, I can't do anything. I'm a noodle, and I'm in excruciating pain, and I'm having troubles going toilet. And she said, there's a slight chance that it could be, just an incy wincy, small tinsy wincy chance that it could be this particular thing, but it's not very likely. And you would have to be having like incontinence problems. You would have to have trouble going toilet. And I did say to her, obviously, I've been saying to every doctor that I've been talking to that of course I've been mentioning I've got toilet problems. And she said, well, I checked your notes and it's not on there. And obviously this is the day 3-4 now. I asked the student doctor next to her, because she had been there the day before with the horrible doctor that keeps saying if I can laugh, I can get up and walk every day. And she's been there with other doctors. And I asked her verbatim, have I not been mentioning this symptom, that I've had trouble going toilet? And she literally was like, yeah. Like she couldn't lie, because it happened so many times in front of her, like 3 times separately, that she had to obviously say, yes, this happened. Thank God for that. There were honest people there, thank God. But it was at that point that Dr. Julie finally said, okay, we're going to order an MRI, because, it could be this. And I had my MRI, and they used some sort of red sheet to carry me onto MRI. So this is the first time they've actually offered me help in terms of actually lifting me off the bed properly. I didn't know there was a sheet for it. Before they were just using arms and stuff and then complaining about it. But I don't know the procedure. I'm just asking for help. I don't know how else to get on there. Anyway, I had my MRI, and I finished my MRI. They left me outside the MRI. Like for hours. They left me outside the MRI for hours. Apparently they had ticked off somewhere that I had been collected. And I only really noticed because I was trying to do that the trend with the Miley Cyrus, I can't wait to see you again. I was like, well, since I'm going to be here towards the end of March, then this is probably where I'm going to do that video. So I was trying to record this video. I will say, this video is when the porter was taking me back, and obviously he knows I'm videoing for social media, and he was like, shh, you can see it, because he realized how long they had left me. And like, it wasn't until the lady from the MRI came back out and was like, what are you still doing in this corridor, that anyone even thought to check for me.
Road trip.
At this point, it is obviously I've gone to my MRI this morning. I've come back.
They left me, guys. I was waiting outside MRI for like
and it really wasn't that far away. And I've asked when I got back, can you please change my food, because it's now obviously terribly cold. I haven't had lunch. And can you give me my pain medication, because I missed a dose or two. I'm supposed to be having it every 2 hours. They give me morphine as well as codeine at this point, at the strongest dose. And I've asked if they can bring the commode so I can go to the toilet. So I've asked for pain medication, the commode, and my food to be changed. Now, if we fast forward over to 5 o'clock-ish, I've been sitting there for 45 minutes crying and screaming, as is the patient in the bed across from me. Now, I don't mean politely. I mean screaming bloody murder. I mean screaming down the A&E. I mean, we were so loud that, doctors and nurses are walking past us looking like we're crazy. Obviously, you can hear us loud and clear, like the whole A&E can hear us. And the doctor's desk is just next to my bed, because I'm at the bed right by the edge. And the doctor's on the phone kind of blocking her ear while she's speaking to a patient. So we're actually just being ignored while we're asking for help and, saying, can someone help us? Now, the reason we're screaming and crying and actually, shouting the ward down, I will say that the reason that the patient across from me was doing it, because for context, she has flesh-eating bacteria. She has necrophagiitis. Am I saying that right? Oh, I need to Google that word. But she has flesh-eating bacteria, and her leg is literally black and all the way up to here, and she can't move it or do anything with it. And she's screaming because she's fallen out of her bed. She's fallen on the floor. She can't get up. She's in pain. We were screaming for a while. We were screaming for about, like I said, about 45 minutes now. And I mean, eventually someone did come in and address the screaming. But it was the male nurse from the male side of the A&E beds, because obviously we're on the female side. And he only came to push the tray up to her to say, basically, help yourself up, that our nurse has gone on break for half an hour. And there's no one to help us because he needs to go back to the male side. But we should stop making noise and figure it out. While she's still on the floor, obviously. Sorry, so bad. Maybe I'll get her to throw a quote in here at some point. I don't know. She's got a number. She's a lovely woman. But we're screaming bloody murder. The male nurse came in and pushed the tray up to her. We are still screaming because she's on the floor still. Doctors and nurses are just walking past us, ignoring, because this is the middle of A&E. The corridor's very, very busy. Now I'm screaming separately. Obviously, we're screaming at the same time, but I'm screaming separately because at this point, I'm informing that male nurse that she wasn't gone for half an hour. She's been gone for at least over an hour, because for the last 45 minutes, I've been sitting in my own urine, crying my eyes out, because the commode I asked her to get an hour and a half ago, she brought in, put it in the room across on the other side of the bed, and didn't help me into it, and left. She didn't change the food, she didn't give me any pain medication. So now I'm sitting here in pain, crying, losing all sense of dignity that I might have left. Sorry, I need to breathe. Yeah, this wasn't a nice situation at all. So at this point, the nurse matron comes down. Like I said, it's been 45 minutes of crying, screaming, saying, help, is anyone going to help us? We're in pain. This is ridiculous. I'm, crying our dignity out, basically. And the nurse matron comes down and she cleans me up, and she was really lovely, and she was apologetic. She apologized on behalf of the NHS for the treatment that I was getting, because there's no way someone to be screaming in A&E, anyone to be screaming in A&E, and people are ignoring them. No one really cared in that moment. I guess they were understaffed. I understand that. But when it starts becoming a situation where pain medication is being delayed by at least 2 hours every time, people are missing doses of antibiotics, and people aren't even being physically examined, or people are falling out of their bed unsupervised. I mean, where's the nurse that's supposed to be covering? No, literally, like can you understand what I'm saying? We're in A&E, like accident emergency. This is the beds overnight where people are, anything could have happened. Where's the nurse? Because apparently she went for lunch. Apparently her lunch was half an hour, even though it's been an hour and a half since we last saw her, even though it's been an hour and a half since she brought my medication, since she said she was going to change my food, and since she bought the commode and didn't help me get into it. So now the nurse matron is apologising on behalf of the NHS. And this is what I sounded like.
Not yet. Do you want me to try and get some painkillers before I change you? Yeah? When did you last have them, do you know? Hours ago. Okay, give me just 2 seconds. What's your full name? Let me just have a look in the system. Mary. Okay, 2 seconds. I'll look for someone else to get them for you while I'm taking Not pain. Thank you, love. Okay, my love, my colleague's going to get you some painkillers, and I'm going to get you changed, okay? Now, can I just move some of these out of the way? Let me just... How How do you normally get to the toilet, sweetie?
I asked them to be the command ages ago. If no one was coming.
Let me get you freshened up and sorted, and then we can have a proper conversation, okay? Do you want this?
Sorry. Why did they leave us for so long?
I'm so sorry. It's just they're very, very busy today, and they've had to swap and do different areas and all the rest of it. But I'm really, really sorry. It shouldn't be that you're feeling like this. Can I bring the blankets down and start getting you changed? Is that okay? Okay, let me just leave your phone here.
I'm going to prepare.
3 o'clock. What time is it now?
Can I please have the liquid morphine?
Because I give her 11 o'clock.
Can I have the liquid morphine?
Yeah, I'm going to give you in a minute, yeah?
Yeah. Can I take this down? I'll start getting you cleaned up, okay? So it's 2:45 now, and she's going to get you that morphine. It'll be 15 minutes when it's due. So she's going to get prepared for you now, okay? Yeah? Let me just take these down. I'm so sorry it was such a bad experience, my darling. Let me try and get you cleaned up and a bit more comfortable, and we'll get you the painkillers, okay? No, sorry, my love. Of course. Have they been using the sliding sheet? Have they been using the sliding sheet to...
I went for an x-ray.
Oh, they use it for the x-ray? Okay, so they used it for that, was it? Okay, if I flatten the bed, would that be a wee bit easier?
It's going to be painful.
Do you want me to try and keep it like this? Okay, the only thing is if we keep it like this, I might need you to help me with the turning over and things like that. Is that okay? Yeah? Can we take your gown off? Is that okay? Yeah? I'm so sorry, my darling. I'm so sorry. Let me try and give you a full little wash, okay?
Oh, my God.
You're what?
This is the first time I recorded anything. This was by accident, actually. This was on my Apple Watch. I didn't realise I had this until I had gotten home. But it's very hard to listen to. But I think it's important that I share as much as I can with you guys so you understand where I was in the situation mentally and why I felt like I needed to ask the internet for help by the end of it. Do you know what? It's good because I did just realise live that I made a mistake in terms of I was saying her lunch break and I'm saying 3:30, which obviously doesn't make sense. It's clear that she went for a lunch break at around 1 o'clock. It was then around 2ish where we started screaming for help and asking for someone to help us. So by sort of 2:45 is when the nurse matron came down and offered assistance. This was swiftly followed by the doctors coming down. So Dr. Julie comes back and stands in a row with her team and apologises again on behalf of the NHS. This time, this is because they've realised they've got my scans back from my MRI and they've realised my spine is pinching up my nerves are pinching up my spine and down both legs. And my vertebrae is basically slipped out altogether and they need to send me to another hospital. They're going to blue light me over to have quite an emergent surgery on my spine where they're going to like shave down my vertebrae and like move the nerve that's I don't even understand it, but the neurosurgeons have been alerted and I'm coming right through. But they're so sorry because I've been in a lot of pain. So when Nurse Raider's pulling my legs and helping me sit up, she wasn't helping. She's probably just grinding everything. Sorry, she was so annoying. And when I'm telling them I would need more than, codeine, especially at the levels that they're giving me, which I'm taking stronger doses when I was at home before I even got to hospital, and I still couldn't walk. I was just dealing with that pain cold turkey for no reason. But anyway, we got blue lighted over to our second hospital. And I will say there's a few situations that I should note about the first hospital, just to help you understand the situation that I was in. I mean, there was a patient that was across from me who she didn't speak a word of English, and I don't think anyone realised until about the second day she was there, until she had sort of fallen over, very dizzily, like very, very nauseous, and just sort of fell over the bed and grabbed onto the curtains. And the doctor's asking her, "Why did you get up when I told you to sit down?" And she's just looking very spaced out. And I've suggested, "Do you think she speaks English?" I've gone on my phone, on my translator app, and gone for a few sort of suggestions as to what language she could speak, and we finally nailed it down after like an hour. I did actually let the doctors know, that she didn't speak English anymore, and this is why she's not been listening to a word you're saying, or looking spaced out when you're talking to her. And I asked if they have an interpreter for her, because there should be one, a translator or something. You know what I mean? They said that they've got one on the phone that she's going to call in 6 hours or something like that, but they can't get one in person, and it was just very bad. This poor girl, I think they were obviously sticking needles in her and stuff, and she had no idea what was happening. She was terrified. I mean, they couldn't even get her home address without me asking her to, calm down and see if she can help me get the address so I can, we can order you her transport home eventually. And she was honestly so grateful. Like, she was blowing my mum and me kisses the entire time we were there, for actually taking the time to help her understand that she was very lost. There was an interpreter for her, translator for her, eventually, but it was on the phone for about one quick consultation, and then she was left alone in the dark again. There was also another patient who was probably in her like 90s, who at some point, now she's been being visited by her grandkids every day, and I mean, she had like 17,000 grandkids who just all wanted to make sure that grandma was okay, which was the sweetest thing in the world. There was a day where someone in scrubs came and closed the curtain around her, and me and all the other bedfellows are just looking at each other, because we can just hear words like, "Stop, get off me, you're hurting me, ow, please stop it, please don't do that again, someone help me." And we're all literally piping up going, "Whoa, what's going on here? Like, seriously, what are you doing to that poor woman?" And the guy comes out, pulls the curtain around his face and just says, "Hi guys, it's absolutely fine. She's a bit old, she's got dementia, these things happen. Sometimes they say things and scream things they don't really mean." And I let him waffle for a little bit, but then I did actually mention to him that, I did inform him that since her 17 million grandkids have been visiting her, she has been talking, eating, advocating for herself, saying what she wants, having conversations all day. We can all hear her. These walls are literally paper, they're curtains. So what do you mean she has dementia? She doesn't know what she's saying or doing, and if she's asking for help, I'm a bit concerned. He just said he's gonna get someone and be right back to explain it to us, and he disappeared and never came back again. I did mention that to the nurse matron as well, so hopefully she put that in a report somewhere. I mean, like I said, people were moving the call bell from us, and pain medication being delayed. A lot of things were happening in that hospital, that first hospital. So, but this hospital isn't even the main part of the story. It gets much worse when we get to hospital number 2. So, stay tuned, guys. Like I said, I will share what I can, how I can. If I'm wrong or if I need to correct myself, I'm happy to check my notes and do so, because we're humans, we make mistakes, but I'm not afraid to make a mistake, because I know that everything I'm saying is the truth. So, adjustment or not, no word of a lie will be told. So thank you for your attention to this. Thank you for caring. Thank you for listening. And if you can offer any advice as to how I go on from here, please do. But at this point, I think this is sort of my therapy, where you guys are the investigators, and try and help me deal with this. Yeah, I can't wait to get into the next hospital. See you soon.